Your doctor has recommended that you have a TUR-BT, or Transurethral Resection of a Bladder Tumor. Before we talk about the procedure, let's review some information about your body and your medical condition. The bladder holds urine until you release it. It stretches like a balloon as it fills with urine. Muscle in the wall of the bladder works to push urine out of your body through your urethra. Your surgeon has recommended a TUR-BT to remove a tumor from the lining of your bladder. About half, or 1 in 2 bladder cancers are found early. That means the tumor is still in the lining of the bladder and hasn't spread. Bladder cancer can be diagnosed at any age, but is most common in patients that are over 55 years old, men, and are white. Bladder cancer is most often linked to smoking and exposure to certain chemicals in the workplace. With a TUR-BT, or Transurethral Resection of Bladder Tumor, a surgeon uses a scope to look at the bladder lining and remove the tumor. A scope is an instrument with a light and camera. It has a loop at the tip that can cut with heat energy. The tumor is sent to a pathology lab for examination. Further treatment may be needed in the future after this surgery for your cancer. These plans are made if needed after the procedure and based on the final lab results. Now let's talk a little more about what happens during a TUR-BT. To start, you are given anesthesia to keep you free of pain during the procedure. You are positioned carefully. An instrument with a camera, called a scope, is then gently inserted into the urethra to reach the bladder. Once the scope is inside the bladder, your doctor will fill your bladder with water or saline. Using the fiber optic light and camera lens of the scope to see, your doctor will look carefully at the walls of your bladder. The tumor is cut away from the bladder in small pieces using the loop. Your surgeon uses suction to carefully remove those pieces from the bladder. The loop is also used to stop any bleeding that is seen. After the surgeon makes a final inspection of the bladder, the scope is removed. A thin, soft tube, called a Foley catheter, may be placed in your bladder. This tube can be used to fill your bladder with chemotherapy as part of the procedure if needed. This chemo or medication is used to prevent loose tumor cells from sticking to your bladder lining. Sometimes the Foley is left in for a few days to keep your bladder empty for healing. When it is time to be removed, the balloon is deflated and the tube easily slides out.